Preparing for adulthood. Taking charge of my own healthcare. What can medical providers and teachers do to help you take charge of your own healthcare?
One of the things that doctors can do to help me take charge of my own health would be to give me a pamphlet or links to more information so I can learn more and remember the information, because sometimes the appointments rush and it is hard to pick up all the verbal information.
Medical providers. Explain things in a way that is easy to understand. Provide additional resources.
One day I went to my appointment with my psychiatrist. He asked me if I knew my meds, and I said no. And then he said, I'm going to give you flashcards and helpful advice that say how much it is, what it does, and the symptoms to look for.
Take time to respond to questions. Encourage youth to get involved in their medical care.
I'd rather them to say something to me than share it to the guardian. It's better to talk to the kid so they don't freak out. I'd rather them to stay for a while. I just want them to talk to me and to say what's going on.
Help with transitioning from pediatric to adult providers.
I think doctors and psychiatrists should give us more pamphlets or direct advice on when we should transfer over to an adult psychiatrist or doctor, or how do we get our medication, when can we be on our parents' insurance, just how to take that next step as an adult so you kind of just don't become an adult and then just not know what to do, because preparation is key to know what you need to do.
Parents can also help with the transition process.
I would need my mom to show me how it's done. She would be right by my side and saying, okay, honey, this is how we're going to do it. And if I didn't get it the first or second or third or fourth time, she would help me gently go over it slowly and at a pace where I could hear it.
Teachers. Ensure that related services, such as school nursing services, are in the IEP. Include frequency, location, and duration of services.
On the IEP, well, if you take medication at school, I guess they could tell you if you forget, go to the nurse, or maybe actually know when I'm supposed to leave to get my meds, instead of just saying, oh no, you can't leave.
Youth. Learn how to become an active member of your healthcare team. Ask questions, prepare for appointments, share information. Consider developing IEP goals that address skills needed for transitioning to adult healthcare.
Sometimes when I go to my therapy appointments or doctor's appointments, they want me to remember what they talked about and stuff. Writing doesn't come easy to me, so I asked one of the doctors or therapists to write it down and then remind me next week what we could talk about or what we are carrying on to talk about, or think of new things to talk about.
Youth. Learn how to fill prescriptions and take them as prescribed.
Yeah, I know how to take my medications because my guardian puts it on the table with a little box. I don't know how to fill my prescriptions or get prescriptions from the pharmacy or not. It's kind of hard. I need to start figuring out taking my own meds pretty soon because I'm getting a little older and people won't be around as much.
Youth. Taking charge of your own healthcare.
So, and it's that kind of responsibility that at that point I would be ready for, as long as I know, hey, this is what I'm going to be doing, who I'm going to be asking for, and then the next step would be to talk about it.
I'm taking charge of my own health care by filling out my own appointments, calling the pharmacy when I need a refill on prescriptions, driving myself there to pick up the prescriptions, making sure I get to the doctor's appointments on time after scheduling them, looking between my school schedule and work schedule, making sure that I am available to get to the doctor's office. And I do that by setting timers on my phone, alarms. And when I do have to take medicine, I do set an alarm every day at a certain time to take it, to remind myself that I need to take the medicine.
Youth take charge by making healthy decisions, working on being an active member of your healthcare team,